So Dr. Pennington, our patient is a 22-year-old male with a history of asthma who presented to the ED today with a gunshot wound to the right thigh. The bullet shattered his right femur, and the trauma team asked us to consult because of his history of asthma. He was stabilized in the ED. He reported some shortness of breath at that time. However, his O2 sat on 90% room air was 90% on room air with diffuse wheezes, both inspiratory and expiratory. Portable chest x-ray was normal. He was treated with a nebulizer treatment ×2, and he had symptomatic improvement. He was taken to the OR, and post-op, his O2 stat dropped from 95% on 2 liters of nasal cannula to 89%. CTA was ordered, and we were consulted. So he has a history of asthma since he was a young child, and he's been hospitalized 3 times, the last time being at age 11. He's never been intubated, but he reports recreational marijuana use, and the last time he used marijuana was 4 days ago. He's on a controller med that he doesn't usually take regularly, and he actually doesn't really remember the name of that medication.
I'm so tired of violence in this city. It never seems to get any better. You think that people would have something better to do than to kill each other. At his young age, I bet he's already been incarcerated. At any rate, what do you think is going on?
Well, I think that a PE should be high up on the list, but he also has asthma, so that could have something to do with what's going on.
That's good, and that was a better assessment than you did with that patient with pneumothorax who presented a couple days ago in shortness of breath. Assuming her findings are accurate, what's the first thing you think we should do with our gangbanger?
Well, I think we need an ABG and a CTA for starters, Dr. Pennington.
What do we already know about his acid base status?
We haven't gotten an
Did you
ABG.
check his lights?
Well, I was going to say that...
Well, at this point, we have a respiratory alkalosis based on his bicarb, but that doesn't help us in this situation.
That's correct. Let's move forward with your recommendation that we get an arterial blood gas, an urgent CAT scan angiography. What do you say we go see our gangbanger? Is he Hispanic? I know that there's a huge gang problem with Latinos in this part of the city.
Well, he's actually black, but I don't think that
Let's see if your physical exam skills have improved since that patient with pneumothorax.